Hello everyone, welcome back. Dr. Priyanka here, Director and Consultant Gynecologist at Kanva Diagnostics Services. Well, today I'm here to talk to you all about Polycystic Ovary Syndrome. So this is very common. In fact, you pick 10 girls out there, I'm sure at least 2 or 3 of them have it. So especially when it comes to the teenagers, they always come to us with 2 main complaints. Obesity, that is, I've been putting on weight without eating much, is their complaint. And the second thing is irregular periods. So most commonly this happens because of our lack in our exercise lifestyle, including sedentary lifestyle and our diet, which is more so into our junk food and eating outside. Not that if you eat at home, you're eating healthy, but you should eat healthy food at home. So even if you're cooking a lot of oily items at home or dairy products at home, it's not a good habit. Now, what is the incidence of Polycystic Ovary Syndrome? At least 5 to 22% is the incidence of Polycystic Ovary Syndrome. So it's quite a huge problem in our society today. The main complaints a woman come to us with are irregular periods. Then there can be infertility if they're in the reproductive age group, or they can come to us with acanthosis, that is velvety growth around their neck or around their lips. These are the places where they'll see velvety black growth. That's called acanthosis. And they can come to us with hirsutism, excessive hair growth on the hand, facial hair in women. So these are the complaints they commonly attend to us with. One other complaint, especially with the teenage girls, is acne. They come to us with a lot of pimples around their cheeks, on their forehead. This is because of hyperandrogenism, which is again a consequence of PCOS. So hormonal imbalance makes you put on weight. When you put on weight, your imbalance becomes more. So it's a vicious circle. You keep going round and round. The one and only way out of the situation is 25% from our end in the form of medicines, but 75% is in your hand. Good exercise, good diet. When I come to the diet, I mainly concentrate on telling you people to stop sugars and dairy products. Curd and buttermilk to some extent is allowed, but any other dairy product, I would ask you to avoid it. All this said and done, we also need to remember that PCOS doesn't just affect us today, it leaves us with long-term consequences, such as a woman who is with PCOS today is prone to have diabetes, hypertension, and on the long run, she's even prone to have endometrial cancer. That is why I always suggest all my patients, don't sit and wait for your periods to come on its own by 3rd month, 4th month. No. If it doesn't come in 1.5 months, please visit your doctor, take withdrawal bleeding and make yourself get periods. That withdrawal bleeding saves you from endometrial cancer on the long run. Thank you.